I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar, and welcome to my October myth-busting series, where I bust a different myth about breast cancer every single day of the month. Today's myth: antiperspirants or deodorants increase the risk of breast cancer. This is an article from the American Cancer Society in which they have looked at multiple different studies and evaluated the level of evidence there is against antiperspirants or deodorants. And the studies that have been conducted are case control studies with pretty flawed designs, and none of them showed a definitive link between breast cancer and antiperspirant or deodorant use. Here's an article from breastcancer.org in which they also summarized all of the available evidence and saw there was no strong evidence that suggested a link between antiperspirants and deodorant and breast cancer. And this is a meta-analysis which was published in 2024, or a large study kind of compiling all of the data from these smaller studies that looked at if there was a link between antiperspirant products and breast cancer, and they concluded that there was also no clear evidence that there's a link between the two. Sometimes when I bring up this evidence to anyone who brings this myth to me, they say things like, well, some of these antiperspirant products have aluminum in them, and aluminum might increase the risk of cancer. Or some of these products might have parabens in them, and parabens have been shown to increase the risk of cancer. And certainly those statements might be true about those individual components of antiperspirant products, but not enough gets absorbed by the skin when you're actually using deodorant for it to increase the risk of breast cancer. And we don't see an increase in breast cancers in the upper outer quadrant or under the arm from people who are using those products. So if you are avoiding wearing deodorant because of this myth, please don't. Please feel free to wear it because it is completely safe to use deodorant and antiperspirant products. And if you want to be as proactive as you can about avoiding breast cancer, exercise every single day, get your screening mammograms, and if you're high risk, get other imaging studies like MRIs.